FTP community, we've got a really special treat today. We are sitting down with Dr. Sophie Armstrong, one of the sports physicians and partners of North Sydney Sports Medicine, who we teamed up with for our Pacific Highway Clinic, which some of you will have visited, a lot of you haven't. But we're going to go through a whole bunch of Q&A, just getting to know what it is exercise and sports physicians do and how they can help you and how we can work together to optimise your outcomes. So something that comes up all the time is why sports physician? I think a lot of our patients especially are a bit confused sometimes about what they should see a sports physician for, or when they should see a sports physician and what it is that then you might do. Yeah.
So as a sport and exercise physician, we've all been to medical school and then we've all done our specialty training with the Australasian College of Sport and Exercise Physicians. So we will see, people think that you have to be super sporty or an elite athlete to come and see us, and that's absolutely not the case. Of course, we look after the sporting population and the elite athletes, and lots of us have worked with various Olympians or Commonwealth athletes and currently work with elite teams. However, the majority of our day-to-day work is working with the general population around anything related to musculoskeletal injuries, issues, pain, limitation, reduced function. For example, if you've got OA or osteoarthritis, if you've got a sprained ankle, if you've dislocated your shoulder, all of that side of things, you can come to us, we can assess you and work out your next best step or treatment options. We also look after all manual workers with regards to any injuries at work, disabled athletes, pregnant people that want to stay active or are looking to be active during their pregnancy, and also chronic diseases, so people with diabetes, people with asthma, particularly if they're limited with what they can do related to their asthma, for example, or any other chronic illness.
Yeah, right. So in terms of if I'm running and I roll my ankle and it blows up, a lot of people would think go straight to the physio. Where would exercise sports physicians come in that course?
So absolutely sensible to go to the physio at 100%. That's totally fine. We can also assess you as well and consider whether you might need an x-ray, for example, or any further imaging, or simply just advise you around pain management, or if you need any anti-inflammatory medication, and then looking at the best rehabilitation options for you, likely with physio, also with exercise physiology as well.
Yeah, right. And it can be any part of the body.
Absolutely,
so
we
back,
see everything.
Shoulders, necks,
everything. We see everything.
Yeah.
Some of us specialise in certain areas, but we ultimately see everything.
Yeah, right. I think one of the things that I explain to patients all the time, and this is a very lay approach to explaining sport and exercise physicians, but it is effectively like a traffic conductor, that there's no real ongoing long-term treatment that you provide, but you can navigate where they should go, what should prioritise first over the next. Would that be somewhat?
Yeah, so we'll sit and listen to someone's story around any injury or illness and work out. For example, they might need some imaging just to confirm a diagnosis or look at any issue in a bit more detail. And then we talk to them about the next best steps for them. So it may be that they need some treatment that we can offer, for example, shockwave therapy or any type of injection, and we'll do most of them in clinic. A lot of what we see needs appropriate rehabilitation or exercise as a prescription, and so it's about guiding someone who's the best person for them for that type of rehabilitation or kind of strengthening work.
Yeah, right. That's I think you hit the nail on the head where so many people think that it's for athletes only. And my experience being involved has been that most of the people that come in through the corridor
100%.
aren't athletes.
Yeah, the athletes that we see are definitely the minority. But it's good we get to use the principle of how we would treat our elite athletes and absolutely give that to the general population as well.
Yeah, right. And so with in the medical space or spectrum, most people would think of GPs and surgeons, and
we
they're
kind of
not
sit
sure
right in the middle.
Right in the middle.
Yeah.
So typically people will see a GP and then come to you, but they don't always have to see a GP to come and see you, but it's preferred.
It's preferred, yeah, it's preferred just so that we've got continuity of care. We can write back to the GP, keep everyone in the loop about what's going on, but someone is able to come to us. It's all to do with Medicare and rebates and what you get back from Medicare with coming to see us, but you can definitely come and see us if you feel appropriate, 100%. Yep.
And then you guys can help them navigate whether surgery is a good choice or not.
Definitely.
A choice.
So we have good relationships with lots of surgeons, all areas of the body. If we feel that it's appropriate or that you need to have surgery, we will absolutely send you to the surgeons. But if we don't feel that you need surgery, then we can talk about what's the best step for you.
Yeah. So where would people typically come from to see a sports physician? Are people mostly recommended by other healthcare providers?
All sorts. So we get lots of word of mouth, physios, exercise physiologists, but also GPs as well, and surgeons. So surgeons, if they feel that if someone's been to see them and it's very much a conservative approach that's needed, then we can do that for them.
I find that a lot of people come in to see us, and because they're coming in to see exercise physiology, they're coming in trying to avoid a medical model,
Yep.
a medical intervention.
Yep.
And so I think they probably steer away initially from medical intervention, which they probably don't know that you're not really intervening hugely, right? It's not like surgery. But it's when they start to run into problems, or if there's symptoms or experiences that the patient's having that don't match the function that we're looking at, that's when I'll tend to refer out to defer to you guys.
And so much of anyone's injury or illness is about educating them about what their disease, for example osteoarthritis, that's associated with a huge spectrum of symptoms that is very varied and individual, and it's just about reassuring that patient, educating someone around that it's okay to feel X, Y and Z, that's normal, that's part of the process, and then giving them options around what treatment may be available to them that they maybe weren't aware of, that's not always super interventional. It doesn't have to be surgery. It doesn't even have to be an injection as such, for example. It could just be reassurance that getting strong, getting your function back, getting your mobility back is the best thing for you.
Yeah. That's a massive one for the people that I refer in, is that they can sometimes just be getting to that place where the uncertainty is eating them up. That's sort of stymieing them from being able to challenge themselves further. So
and lots of evidence around that education, that reassurance, that knowledge around your issue can make a huge difference with the gains that you then get.
Mm-hmm.